Tell me, have you ever experienced this? A little twinge here, a pull there, a strange noise, and you just brush it off? Thinking, oh, it's just age, what can you do? It'll go away on its own, especially when it comes to your ears. You know, a little blockage, a momentary ringing. It happens to everyone, right? But what if I told you that our ears aren't just organs for hearing, but incredibly sensitive barometers of our overall health, sometimes whispering warnings about serious problems long before they start shouting at the top of their lungs? Of course, hearing can change with age. That's physiology. Our internal mechanisms wear out. But some signals, especially those that seem minor, can be like little red flags, warning us about entirely different, sometimes dangerous processes in the body, issues with blood vessels, blood pressure, the nervous system, or even hidden inflammation. We often ignore them, blaming fatigue or the weather, like ignoring a quiet knock at the door when an important messenger might be waiting. But today, I want to share with you how to recognize these quiet signals, these seemingly little things. I promise that after our talk, you'll understand your body better, learn to listen to it more attentively, and possibly prevent serious problems down the road. No complicated medical jargon, just clear explanations and real-life stories. And yes, I will tell you about that crucial third symptom, which has been a real key to understanding for many people. Please stay with me until the end. This is truly important for your health and peace of mind. All right, let's start with the first such quiet warning sign. Symptom number 1, a persistent feeling of fullness or pressure in one or both ears that isn't related to a cold or allergies. You know, that feeling like you've just come down from a mountain or gotten off a plane, but it doesn't go away for hours, days, or even weeks. I remember Arthur's story. He was 72. A sturdy man, worked as an engineer his whole life, used to compartmentalizing everything and not believing in nonsense. He started getting this strange feeling of fullness in his left ear. Probably earwax, he told his wife. Or I'm just getting old. My ears are acting up. He tried cleaning his ear, used some drops, but nothing helped. The feeling wasn't exactly painful, but it was persistent, annoying. The world around him started sounding muffled, as if through cotton wool. Arthur began avoiding noisy gatherings because he found it hard to distinguish speech. Everything merged into a hum. He was angry at himself, at his ear, at his age. He thought, what kind of nuisance is this in my old age? Am I really going to live like this now, like in a fishbowl? He felt awkward admitting that such a little thing bothered him so much. So, what was really happening? A constant feeling of fullness, not linked to obvious causes, can signal various conditions. For example, it could be eustachian tube dysfunction, that little tube connecting our ear to the nasopharynx that equalizes pressure. Its function can decline with age due to changes in tissues or blood vessels. But sometimes, imagine this, it can be an early sign of Meniere's disease, an inner ear disorder causing dizziness, ringing in the ears, tinnitus, and hearing loss. Or, in rarer cases, it might indicate problems with blood circulation in the head area or even the presence of growths pressing on surrounding structures. Picture a water pipe in your house. If it's slightly clogged deep inside the wall, you'll first notice only weak water pressure from the tap. Ignoring it means risking the pipe bursting one day. It's the same with the ear. This minor fullness is just weak pressure, a signal of a possible clog somewhere deeper. When Arthur finally decided to see a doctor, it turned out he had developing vascular problems affecting blood supply to the inner ear. He was prescribed treatment. The feeling of fullness gradually disappeared, and most importantly, he addressed his vascular issues in time. What's the benefit for you? Don't dismiss a persistent feeling of fullness. If it lasts a long time and isn't related to a cold, it's a reason to consult a specialist. Early detection of the cause can protect you from serious problems with hearing, balance, and even your vascular system. Listen to yourself. Your body is smart. It sends signals. Now let's talk about the second symptom, which is also often blamed on age or fatigue. Symptom number 2, noise or ringing in the ears, tinnitus, but not just any noise, one that has recently appeared, suddenly intensified, changed its character, or become pulsatile. Many of us get used to a slight background noise in our ears over the years, right? But the key word here is change. Let's remember Eleanor. She was 68. She had a quiet ringing in her ears for several years, which she had almost gotten used to. My crickets, she used to joke. But one day, she noticed the noise in her right ear had changed. It became louder, more intrusive, and pulsatile. It beat in time with her heart. At first, Eleanor thought it was stress. She was worried about her grandchildren at the time. She tried to rest more, drank calming herbal teas, but the pulsating noise didn't go away. It interfered with her sleep, caused anxiety. My blood pressure must be up, she thought, but she measured it. It was normal. She felt confused. The old noise was just background, but this new, pulsating one seemed somehow ominous, insistent. And she was right to be concerned. Regular tinnitus is often the result of age-related changes in the auditory system or noise exposure, but pulsatile tinnitus, which beats in rhythm with the heart, is a completely different story. Imagine a river. Calm flow is normal blood flow. Pulsatile tinnitus is like hearing a turbulent whirlpool or rapids in that river. It can indicate problems with blood vessels near the ear, arterial narrowing, atherosclerosis, an abnormal tangle of vessels, or even an aneurysm. High blood pressure, forcing blood to rush noisily through vessels, can also be a cause. And if the noise suddenly intensifies or appears only in one ear, that also warrants attention. Sometimes an acoustic neuroma, a benign tumor of the auditory nerve, or other issues can manifest this way. You can compare tinnitus to background music in a cafe. It's there, but doesn't bother you. But if the music suddenly becomes deafening, intermittent, or turns into a siren, you'd pay attention, right? It's an alarm signal. When Eleanor finally consulted a doctor and underwent tests, she was diagnosed with carotid artery stenosis, narrowing. She received timely treatment that helped prevent a potential stroke. What's the benefit for you? Don't ignore changes in your tinnitus. If it becomes pulsatile, one-sided, or suddenly worsens, be sure to consult a doctor. It could be the key to early diagnosis of serious vascular or neurological problems. Your hearing isn't just about your ears. It's a window into the state of your entire body. And now we come to that crucial third symptom, the one highlighted in the title of our conversation. And it truly deserves special attention, because time is critical here. Symptom number 3, sudden hearing loss in one ear, even if it's partial or temporary. Imagine, you wake up one morning and one ear hears, as if through a thick pillow. Sounds are muffled, speech is indistinct. Or you're talking on the phone and realize you can barely hear the other person with one ear. George's story, aged 75, is very telling. One morning he woke up and realized his right ear could barely hear. He had to turn the TV volume up louder, constantly asked his wife to repeat herself. His first thought, I must have slept on my ear wrong, or maybe the phone's broken. He waited a day, then another. It didn't get better. He felt somewhat awkward, even ashamed. Getting old is no picnic, he grumbled to himself. Now even my ears are failing. He felt confused and strangely detached from the world, as if partially disconnected from sound. He decided it was probably irreversible, just another sign of aging, and didn't even think about rushing to the doctor. He waited almost a week before his wife practically forced him to go. And yet, this was a situation requiring immediate medical intervention. Sudden unilateral hearing loss is a condition doctors call sudden sensorineural hearing loss, SSHL. And this, my friends, is essentially a stroke of the ear. The causes can vary: viral infection, autoimmune disease, problems with blood circulation in the inner ear, a microclot or spasm of the vessel supplying the auditory nerve. And most importantly, effective treatment, usually with steroids, is possible only within the first few days, maximum, weeks after the onset of symptoms. The longer you wait, the lower the chances of restoring hearing. Imagine a sudden power outage in one room of your house. You wouldn't think, oh, it'll fix itself, would you? You'd immediately realize something is wrong with the wiring or the circuit breaker and call an electrician. Sudden deafness in one ear is exactly that kind of short circuit, a signal of a serious problem requiring emergency repair. When George finally saw the doctor, some time had already been lost. His hearing was only partially restored, but the examination revealed he had a tendency towards thrombosis, and he was prescribed preventative treatment that may have saved him from an actual stroke in the brain. What's the benefit for you? Please remember, sudden hearing loss in one ear is a medical emergency. Don't wait. Don't blame it on age or earwax. See an ENT doctor immediately, or even go to the emergency room. Every minute counts. This is the key that could save your hearing and timely indicate deeper health problems. Don't ignore this alarm signal. Moving on. The next symptom often goes hand in hand with ear problems, but it's also easy to blame on something else. Symptom number 4, dizziness or balance problems, vertigo, especially if accompanied by other ear symptoms, fullness, noise, or changes in hearing. You know that awful feeling when the room suddenly starts spinning, the ground feels like it's shifting beneath your feet, you sway, and you're afraid of falling. Margaret, aged 70, started experiencing such dizzy spells. They came on suddenly, lasting from a few seconds to minutes. "I'm getting old, I suppose," she sighed. "Problems with the blood vessels in my head." She noticed that during the spells, her right ear often felt full and the noise in it intensified, but she didn't attach significance to it. These episodes disrupted her life. She became afraid to leave the house alone, stopped visiting friends. She felt helpless, vulnerable, and her world shrank to the size of her apartment. She just endured it, thinking it was an inevitable part of aging. But dizziness, especially when combined with ear symptoms, isn't just age-related. Our organ of balance is located in the inner ear. That's why ear problems often cause balance issues too. It could be BPPV, benign paroxysmal positional vertigo, caused by crystals, otoliths, becoming dislodged in the inner ear. This is treatable with special maneuvers right in the doctor's office. It could be the aforementioned Meniere's disease or vestibular neuronitis, inflammation of the vestibular nerve. And sometimes, importantly, dizziness with ear symptoms can be a sign of impaired brain circulation, a transient ischemic attack, TIA, or even a stroke affecting the brain's balance centers. Imagine a complex clock mechanism. If one gear, the ear, starts malfunctioning, it can affect another, the balance center, and the whole mechanism goes haywire. Our inner ear is like the gyroscope in an airplane, responsible for spatial orientation. If it's malfunctioning and simultaneously signaling hearing problems, it's a serious system failure. When Margaret finally told her doctor about her symptoms, she was diagnosed with BPPV. After a few simple exercises, the dizziness stopped. She could live a full life again. What's the benefit for you? Don't tolerate dizziness, especially if it's accompanied by fullness, noise, or hearing loss. Consult a doctor, ENT, or neurologist. A correct diagnosis is the key to effective treatment that can restore your confidence in movement, prevent dangerous falls, and, in some cases, detect serious neurological problems early. Your balance is precious. Protect it. The 5th symptom might seem obvious, but it has its pitfalls. Symptom number 5, ear pain, otalgia, especially if it's persistent, deep, radiates to other areas, and the doctor sees no clear signs of infection in the ear itself, otitis. It seems logical. Ear hurts must be an ear infection, but not always. David, 65, suffered for several weeks from a dull, deep ache in his left ear. It would intensify and subside, sometimes radiating to his jaw and temple. He went to his primary care doctor, who looked in his ear. The eardrum was clear, no inflammation. Eardrops were prescribed. They didn't help. David was perplexed. Maybe I caught a cold in a nerve? Or is it my teeth? He wondered. The pain wasn't sharp, but constant, draining. It made it hard to concentrate, ruined his mood. He felt irritated and anxious. What could it be, if even the doctor couldn't see the cause? He started suspecting something serious, but was afraid to pursue further tests. Sometimes the ear hurts, not because of a problem within the ear itself, but because it's signaling a problem elsewhere. This is called referred pain. Our nerve pathways are intricately arranged, so the brain can get confused about where the signal originates. Ear pain without signs of otitis can be caused by dental problems, especially back teeth, temporomandibular joint, TMJ disorders, the joint that clicks for many people, throat problems, chronic tonsillitis, pharyngitis, and sometimes, unfortunately, tumors of the larynx or pharynx, cervical osteochondrosis, or even trigeminal or glossopharyngeal neuralgia. Imagine a smoke detector in one room going off because of a fire in the adjacent room where smoke seeped through the ventilation. The detector, the ear, is working fine, but it's signaling danger elsewhere. Ignoring the signal or trying to fix the detector is pointless. You need to find the source of the fire. When David finally underwent a more thorough examination, including an ENT exam with an endoscope, a small growth was found at the base of his tongue, which was causing the referred pain to his ear. Fortunately, it was detected at an early stage. What's the benefit for you? If your ear hurts, but the doctor finds no inflammation there, don't stop there. Insist on further investigation. Perhaps your ear is acting like an alarm bell, sounding off about a problem in a neighboring organ state. Early diagnosis of the true cause of the pain can save your health and sometimes your life. And finally, the last, sixth symptom that also warrants close attention. Symptom number 6, discharge from the ear, otorrhea, especially if it doesn't look like normal earwax, has an unpleasant odor, contains traces of blood or pus, or if it's a clear, watery fluid. Helen, aged 78, noticed that sometimes after sleeping, there would be a small damp spot on her pillow, occasionally slightly yellowish. She attributed it to maybe drooling or sweating. Sometimes she thought her ear smelled a bit off, but she dismissed it as her imagination. She was a very clean woman and felt embarrassed even thinking about it, let alone telling anyone. She just started changing her pillowcase more often and tried not to sleep on that side. She felt a bit awkward, but reassured herself. At my age, anything can happen. But any unusual discharge from the ear is not normal. Normal earwax is a protective mechanism. It looks like wax, ranging from light yellow to dark brown. Pus-like, bloody, or foul-smelling discharge almost always indicates a problem. It could be chronic otitis media, a perforated hole in the eardrum, or more seriously, a cholesteatoma, a skin cell growth in the middle ear that can destroy bone, leading to hearing loss, dizziness, and even intracranial complications like meningitis or a brain abscess. And if the discharge is clear and watery, especially after a head injury, it could be CSF, cerebrospinal fluid, indicating a skull base fracture. Imagine an old house with a leaking roof. At first, it drips a little, then more, mold appears, unpleasant odor, and then the beams might rot, bone destruction. Ignoring the leak means waiting for the collapse. Any unusual leaks from the ear require immediate attention from the repair crew, that is, a doctor. Helen was eventually persuaded by her daughter to see an ENT specialist. It turned out she had a long-standing eardrum perforation and an early cholesteatoma. She had surgery that prevented further destruction and potential dangerous complications. What's the benefit for you? Don't ignore any discharge from your ear other than normal earwax, especially if it has a color, odor, or appeared suddenly. It could be a sign of infection, injury, or a destructive process requiring treatment. Your body is signaling a problem. Don't turn away. So, you see, my dear friends, our ears are not just sound locators. They are incredibly delicate instruments that can tell us a lot if we learn to listen to them. The symptoms we discussed today, persistent fullness, changing tinnitus, sudden hearing loss. Remember, that's number 3, the most urgent one. Dizziness with ear symptoms, unexplained pain, unusual discharge. All these might not be just age-related or minor issues, but important signals sent by our bodies. Please, don't brush these signals off. Your life experience, your wisdom, has taught you to notice subtle changes in the world around you. Apply this wisdom to yourself, to your body. You deserve to feel good, to be healthy and active at any age. Listen to yourself with love and respect. If something bothers you, even if it seems insignificant, don't hesitate or be afraid to consult a doctor. Remember, it's better to err on the side of caution than to miss something important. Take care of yourselves, trust your sensations, and know this. Taking care of yourself isn't selfishness. It's a manifestation of wisdom and love for life. You can do this. Stay healthy.